My journey is about living, enjoying life, live longer. That's my journey.
In 78, I was diagnosed HIV positive.
Well, I was diagnosed in 1984. At 20 years old, I believe I was.
I was 29 years old when I found out I was sick.
Back then, it was a stigma, you know. It was like you was positive, you were no good.
It was 1989, and I happened to take the test because I went to the Board of Health just to make sure, I was good. And they said, would you like to take an HIV test? I said, sure. I don't do drugs. I don't, have risky behavior. And it turned out positive.
I had all these dreams and plans that suddenly became meaningless to me.
My daughter's father, he infected me. He didn't tell me. I didn't know nothing about being HIV positive. I didn't know nothing about it. It was all new to me.
I already had 3 small children at home at the time. And I think I was like 23. And I just knew it was a death sentence.
I felt dirty. I felt ugly. I wasn't sexual with anybody for a very, very long time because I felt contaminated.
At one time I had wanted to kill myself because I said, well, what's the sense of me living life? I'm gonna die anyway, living with the virus.
What I used to think was like, when it's my day, I didn't think that I was gonna be around till 2019.
The Peter Krueger Clinic was a constant source of hope for me.
Peter Krueger, I've been going there ever since. Now it's going on to 15, 20 years.
Peter Krueger has saved my life.
They were like an oasis in the desert. You know what I mean? Like a glass of water to a man that's dying of thirst.
No, I probably would be dead right now without the Peter Krueger Clinic.
It's amazing what they did for me. Brought me back to life.
They showed me all the love and the care and concern that I didn't get from people who I thought were my friends.
At that time, I didn't have no help, no support. I didn't know where to go to.
I know what it's like to be broken. I know what it's like to live with despair and think that there's no hope. I know what it's like to be in darkness. And I know what it's like to see light again and have people reach out at a time when there's like a window of opportunity in everybody's life. I believe there was in mine, where I saw some hope and somebody saw something in me and reached out and I made a connection. And I have not looked back.
It was a long time ago. It was 1988. Obviously, it's still hard to think about it. My brother Peter was 18 months older than me. I'm in a family of 4 children. And when I was a kid, I just thought the world revolved around my brother. My brother knew he was gay very early on, and he came out pretty early. And my parents were like most parents at the time, like, oh my. And then they moved into oh, you children go through phases. I'm sure this is a phase. And I remember saying to my parents pretty young, it's not a phase, he's actually gay. And they were never, as I recall, rejecting. They were just, what does this all mean? And this will make life harder for him. And so, there were years of adjustment. But he was leading the life he wanted to lead. He was being very successful in his chosen career. He was already the vice president of European furniture at Christie's auction house. Had a very impressive career in a very short span of time. And he was really brilliant and pithy, and I sometimes thought of him as my male Dorothy Parker brother who would do outrageous things, waiting to see how people would react, who were also politically really different. Even people I know today joke that he was the only Republican gay man in New York City, and he would introduce me to people as his commie Pinko sister. And I go, yes, that's right. So we grew up politically different and we'd argue about things, but he mostly agreed with me. He was playing a role for effect for himself. So he was quite the character. Being young and gay and attractive in the 80s meant you just thought you could be wild and crazy and do whatever you wanted. And so he had a life like that.
New York was always fast, but I always was running with the wrong people. I was so busy running around, wasn't paying attention. It was bad. There was so much stuff going on. I just took it too fast. My family tell me to do this and do that. I didn't listen to them. I listened to them when I want to. And I don't blame nobody, I blame myself.
Unfortunately, what he and a lot of his friends learned, there was a price to be paid.
I wasn't thinking about the virus at that time, because I said to myself, well, I'm not going to catch it. I'm going to be okay.
It was rough. It was very rough. I mean, I think the first patients I ever saw with HIV was in the early 80s. I was working in California and San Francisco at the time, and a lot of young gay men, otherwise healthy, were coming in for what was then called fever of unknown origin. And no one knew why these young guys were spiking these high temperatures, having these horrible fevers. They'd get all kinds of antibiotics, all kinds of workup, but no one knew what it was.
When we saw our first patient, it was really a mystery. A lot of providers in many subspecialties were in war to figure out what was wrong with this man. We could not make a diagnosis. Eventually, when other cases began to appear and were reported in other areas of the country, we knew that we were dealing with something new, a severe infection of some sort.
That was a totally extraordinary case. This was a gay male who came in within 6 months, became demented, blind, and died. And he was 33. The next thing that happened was a second case. Was a nurse who worked at the hospital came in with another AIDS-defining illness, which we didn't know at the time, but was pneumocystis pneumonia. And it was a nurse, and he was dead in 2 weeks.
There was a lot of uncertainty, there was a lot of fear, apprehension among patients who came in for their care, but also among providers. We did not know whether this infection was transmissible, how transmissible was it, whether we were vulnerable to this infection. We were also fearful, we put on brave faces, yes, but we were fearful, especially in the early few years.
And then in 1981, AIDS was described. It was found that these gay young men had terrible infections and cancers that proved that their immune system was severely impaired.
With this entire epidemic, from start to really practically where we are now, there barely was a roadmap to follow. There really wasn't.
I think he knew he was sick before he got diagnosed.
Joey, he was 9 months when I found out he was sick.
I feel like he already saw the writing on the wall, perhaps even a year or two before he was diagnosed. I know that he had friends and ex-lovers who ended up coming down with what nobody really understood was actually AIDS then.
One of the doctors told me that he had one of the symptoms of AIDS. And I was like, what are you talking about? She was like, you see all these lymph nodes on him? And I said, yes. She was like, that's one of the symptoms of AIDS. And I was like, no, you gotta be wrong.
It was just the gay illness, the gay sickness. And so I think he knew it, but didn't want to confront that.
I had to do a consent and give them permission to take his blood. So they told me I had to wait 2 weeks to get the results back. It felt like years. It's going so slow. And they were taking too long, to come and tell me. I already knew he's sick. So that meant that if he was sick, I was sick.
I think in '87, about a year before he passed, he finally told my parents. And my father moved into what was the mode of my father. When there's a problem, you go out and find the solution.
So what do we do now? I went home to tell his father that my son was sick. I didn't know how to tell him.
My father started his world exploration of what kind of scientific research was being done, what doctors were there to talk to, what medical care was there to get. Were there drugs in other countries? He could fly over, pick them up, and bring them back. Were there doctors doing the research in other countries? He could fly over, get them, and bring them back.
I was like, God, please just give me the strength to do what I have to do with this kid. I cannot let him down, because he didn't ask me to have him. I had him because I wanted to have him. I just wanted him to be my son, my kid, And I just was like, God, please. I just want him to be all right. He passed away on me in '95.
My father was very, very focused on, we're going to get this one taken care of. Which, of course, unfortunately, my brother was too early in the storyline for that to have happened.
We think the obituary in the New York Times was the first one that used the word AIDS. All the other people who had died from AIDS, the obituary said that, well, they had pneumonia or they had cancer. After he passed away, the family was approached about ways that his memory could be honored at the hospital where he had his care, where he died.
That thing is now sort of a blur to me because it was 40 years ago. I've sort of blocked that, maybe unknowingly, from my memory. But when I saw the pictures this morning, those memories came back. And it gave me a heartache about what it was like at that time and how I wished it would have been different.
I remember more the people that lived and the people that died, and maybe that was my own defense mechanism.
I've never even tried to put numbers on the number of patients that I lost, but it's a vast number.
It was hard to raise money for AIDS at the time because there was, really horrendous stereotyping and terrible things. I mean, there were politicians talking about camps for people with AIDS at that time in history.
Until there is a cure for AIDS, I say AIDS victims must be isolated from society to protect the rest of the American people.
Every Monday we'd come back and the question would be, okay, so who died over the weekend? And if you were on vacation, oh my God, because then it was like a week. And after that, there would be a lot of names. So that was the sadness, the loss, the suffering.
It was difficult to get investments in the medical research that we knew that was needed. And so I think that my father saw two things, that there wasn't enough being done, but that there were actually very smart doctors and researchers around the world who were trying to get their arms around this, trying to come up with answers, but weren't getting enough support.
I would watch the people who would come through, and when you got an HIV diagnosis, many of these people were not anticipating this was ever going to happen, and they completely lost it. And Krueger Clinic staff were able to keep them together and say, this is not the end of the world. We'll work this out with you. We'll hold your hand and we'll get you through this.
In my parents' vision of what you do when you see those problems, you try to fill the vacuum. They needed to help with the medical services here in New York City, with medical research, and with investing funds in addressing this illness. So I suspect that what probably started this was my father saying to Stanley Yankovitz, so now what are we supposed to do to help you move forward to serve more people?
It was so courageous. It was unheard of. But that reflected the entire family. Their son got infected with a nasty virus that the world seemed to fear and seemed to stigmatize. But they understood very early on that this was something that had nothing to do with their son and the cause of stigma. This was an adversary that had to be fought off. And they wanted to do whatever they could to fight that off.
We weren't afraid of the patients. And sometimes that was the only place the patients could come where they would be accepted and wouldn't be looked down on or ostracized.
I do definitely remember the discussion at the time that AIDS or HIV would not be in the name of the clinic because, again, the stigma was so strong at that time that the clinicians were worried that people wouldn't want to come into a clinic that had HIV or AIDS in the name, and we definitely did not want patients to feel like they couldn't come and go.
We called it the Peter Krueger Clinic for immunologic disorders, and everybody knew what it was for.
How do you destigmatize something or somebody or some concept? How do you destigmatize it? Open it to air, shed light on it. And that's what really Peter was doing, and that's what the Krugers were doing with saying he died of AIDS and saying, we're going to do something about this. And they did.
In the 70s, I lived right around here. I know every place where I lived in the street. I used to live on 14th Street in an abandoned building there where the icicles are coming down from the cold. Lived in the park right there by Peter Krueger Clinic. Being in the streets is not easy. You know, it's very hard. You have to learn how to fend for yourself and defend yourself and make sure that nobody's looking at you or for you, you know, to rape you or beat you up. So I got sick a couple of times being out in the streets.
What was extraordinary about Beth Israel's stance in those early days was the commitment that our administration established. There were hospitals, I won't name them, around the city that were turning away such patients. It was well known. They would have nothing to do with these types of patients. These patients would be responsible for other patients fleeing their medical centers, not Beth Israel. On the contrary.
They say sometimes look at a person in the mirror or look at yourself in the mirror. And that's what I did. I took a good look at myself. And I didn't like what I saw. So at that time I said, okay, I'm gonna get it together more. The first place where I went to was Beth Israel Peter Krueger Clinic.
Before Peter Krueger Clinic, it was more along the lines of people going to private doctors and doing the best they could, or going to a health center and seeing what they could do. The providers weren't trained for any of this stuff. A lot of them couldn't identify this is what people actually had. There was a lot of misdiagnoses, a lot of treatments that didn't work, and a lot of misinformation. And I think the patients passed much more quickly than they ever thought it would because they didn't know what they had.
I would come in like every week, you know, because I wasn't on no medicine or anything. Neither was my son. In the hospital, they wouldn't give the babies no HIV medicine. So when I started going to the clinic, I started meeting people like me, you know, and I was like so shocked. everybody that was around me was positive or had AIDS. You know, I was like, wow, I'm not alone.
Before Peter Krueger, there wasn't any kind of comprehensive service line where somebody could walk in the door and get everything they need in one spot. These patients needed a lot. And if you wind up turning them out and saying you need to go this place for one service, this place for another service, this place for another, they would never get there. Some patients because they didn't have the mental capacity to do it, and some patients physically they couldn't do it. So if you were able to create something where they go into one spot, they can see social work, they can see nursing, they can see psychiatry, they can see ID, they can see your primary care provider, and all the other services that we had. That's a real change in how all of population health was done.
At one time I had wanted to kill myself. But then I got with Dr. Ashley right here at Peter Krueger, and we grew into a relationship with each other. And he was like, Angela, if you die, who's gonna take care of your children? You understand? Who's gonna be there for your grandchildren? So he gave me food for thought for me to have something to think about. And I said, you're right. And I just gave it thought and I said, no, I don't wanna do that.
My first day, I walked into the waiting room. People in wheelchairs, people in crutches, blind. It was almost like a MASH unit because it was such a bad time in HIV then.
I decided to walk over to the clinic and find out what it was about. And the way they welcomed me in was like, I was like, this can't be a clinic. To me, it wasn't a clinic. It was like walking into something like this, you know, a home, a place where you can go and feel loved. You know, we don't get that too often from clinics.
I remember walking into the clinic, that's when we were on First Avenue before they moved here, and I couldn't even stand up, and they got me a wheelchair, and I remember Dale saying, you have to stop the medication. I was like, I can't. I have like 55 T cells. I used to have 3. She's like, you have to stop. The medication is killing you. We'll find you something else, don't worry.
Dr. Sandra Militant, she gave sympathy to us, you know, and she gave us that love. And you don't find that in a lot of places. She needs to sit down with us and laugh with us, cry with us. I felt like a human being.
No matter how I saw myself, I was always treated with dignity. There was never a look of disgust. I looked at myself with disgust. There was never a look of disapproval. A look of concern is different from a look of disapproval. It was always encouragement, always a hope that, come on, you know, you can do this.
I was fearful from the start. At the same time, there's something inside me that says if I'm afraid of something, I'm gonna go right for it. And so I go right for it. I said that I wanted to create a program that would be able to take care of me when my time came. And so I had every anticipation that I was going to be positive and that I would die, but I wanted to make sure that I had something in place. So that was driven by a fear. It wasn't my only drive, but it was in the mix to be able to create something so I knew I wouldn't be left out in the cold when my turn came.
My journey with HIV is about going from shock to strength, to resilience, to life.
We asked for a lot of forgiveness, but no permission, and we kept on going, and we accomplished amazing things.
We just kind of did it as we went, and if it worked, then we were going to do it until somebody told us no, and no one did, thank God. Because I think there's probably times we did go rogue, but it worked, and that was all that mattered, because the patient came first, and the patient still comes first.
The patients were given, instead of one drug at a time, we started treating them with 2 or 3 drugs at a time, and that made an immediate difference. You know, people started to live longer, they were no longer wasted, started gaining weight, and actually went to the other extreme. But that changed the life expectancy of most patients. And then, of course, after that, newer drugs came into the picture.
Suicide came up a lot, and I used to tell my patients, you're going to do what you feel is best for you. If you feel that you don't want to live a certain way, you'll do what you need to do. And don't tell me about it because I don't want to have to report anything that I don't want to report. And again, that's probably going rogue because in the realm of social work, we're not supposed to do that. But I think people have the right to determine their own fate.
It's really hard to even explain what it felt like even back in those days, because people would say that to me all the time. They'd be like, but you work in a place where people die all the time. I was like, yes, but it's still one of the most joyful places I've ever been in my entire life.
In 1993, I started a program. We got funding for what they called, and I hate this term, the AIDS orphans. They were planning on setting up guardianship because they didn't expect children to have their parents alive by the time they were adults. We did what we could, and we had parents make videos so that the children could watch videos of them either reading books or telling them stories or their life lessons that they wanted them to learn.
There was always laughter. There was always someone, cutting up or pulling a joke or something like that. There was always this sense of helping. Even if it was just something really little, it didn't, have to be anything giant. Just someone smiling, someone touching someone's hand. There was always that feeling there.
We had holiday parties every year, and John Weber would play Santa Claus, and we would take them to Dorney Park and Great Adventure and do whatever we could to build these positive memories for the families and take pictures, and so that they had memories of good times with their parents, not always around illness.
It was just so amazing to me because I remember thinking, how are they having a good time knowing all this? And yet they did.
I loved those patients. One of the patients, she had nothing. I mean, she was all alone. She was a gay woman. Finally, she stopped using. She brought me this little angel, a little angel for Christmas. It was so sweet.
Our waiting room was, just like the ultimate coffee clutch. It was great.
There was a table, and everybody cooked at that table, and the patients were all there along with the staff. What is a better example of family than that, than feeding your family?
Another one of the patients, she's Puerto Rican. I think she grew up in Fulton houses, and it was rough at that time. There was a homeless guy in the yard, and people were going to set him on fire, and she fought with them to save this homeless guy. I mean, these are our patients, and she's very proud of her Puerto Rican heritage, and she gave me a little necklace with a flag of Puerto Rico on it, which I still have.
I remember I was working with one woman while we had families in transition. Her brother was going to be the guardian for his niece, and she got sick very quickly and was in the hospital for about 5 days. And I went in the morning to visit her, and he was there, and it was his niece's, her daughter's birthday, her 7th birthday. And I said, I'll come back after lunch. And I came back after lunch, and the bed was empty, and I was like, oh, no. And I found him in the waiting room, and he was like, she's gone. And he's like, and now I have her party. What am I supposed to say? And I said, you have her party, and you tell her tomorrow. She's 7 years old. She doesn't need to know this now. Let her have her party, and let her have her birthday.
I'd buy all these votive candles. Every night I'd come home screaming and crying and just light all the votive candles for the people who had died. Because it was hard. It was hard seeing so many people go.
I would go into an office and cry. I would yell. I used to scream how unfair it was, especially when somebody declined so quickly. Like I even looked for blame. Like, did somebody miss something? Did they not get their medication quick enough? Did we not get them to the emergency room quick enough? And there wasn't anything. It was just my own frustration.
I guess the thing that kept me going was that we could be there for them and help them through this time. Because a lot of them were alone. You're a nurse, and you want to help people. These are good people. They don't deserve to be ostracized or shunned or forgotten because, they're gay or they're using drugs or whatever, They deserve to be cared for and loved.
And the people at Peter Krueger Clinic asked me for one definition: passion. And I was so proud to be part of that passion.
My journey is about making a difference. I think that's what it is. as a nurse, as a human being, making a difference for people who might not otherwise experience people in their lives that want to help them make a difference.
The lives of AIDS patients mattered, and we should remember it. I used to tell my patients, it's my job to keep you alive until the good therapy comes. I wanted to be in a helping profession. I've always wanted to feel that every patient visit in the office or in the clinic or in the hospital, that I contributed something. I had many dozens of patients, I don't know, probably hundreds, who ended up dying in those 15 years before the good therapy was available. And I felt bad about each and every individual one. I think what sustained me and what sustains a lot of people is feeling that you've contributed something.
I remember the first patient I lost. It was transgender female, and her hope, and it was in 1991, her hope was that her name was changed to the female version before she passed away. And we got that done, and she passed away, and I'll never forget, I was outside sobbing. And Dr. Solomon, who's always so stoic, came over and was just like, it's okay, it's okay. And I'm like, no, this is not okay. I don't think I can do this for very long. And here we are, and I'm still doing it. I was like, okay. Sometimes I wonder, like, how? And it's really because of the community that Peter Krueger has become.
We took care of each other, we took care of our patients, we cried, we laughed, and I will never, ever forget it. And I am so grateful to have the opportunity to have my nursing career be where it's been, because it's been very special. Unless I could have been a rock star, but that's not happening.
I still know all the names. I have a list of all those names handwritten. We used to keep the list by hand, so I kept all that. Nothing was like Krueger, ever. It never was. And it was the essence of the spirit of the place and of the patients, and they were always felt so part of it. You know, that was, I think, what was great about it. The next generation and generations to come need to know this, need to know what worked, what didn't, and what, in a way, what sometimes wonderful things emerged from what otherwise looks like, you know, the darkest days.
It's very important to me. It's not just important to me, but to the patients who survived this epidemic, for the staff, the nurses, the doctors, the social workers, the counselors who helped the patients get through this, and for the kids in the future who, some of them don't have any idea of the history, and some of them still don't know that it's still an epidemic. I have young kids come in with all these STDs. You're riding bareback at some internet meetup and you're spreading all kinds of stuff all around. Oh, what's the big deal? You just pop a pill every day. I said, no, it is a big deal, you know. But some of these kids, it doesn't get through to them that this is not something to play around with. People are still dying. It's not as dramatic, and people are still dying.
I do think that the world changes, not fast enough, but it changes, and the story of HIV/AIDS is also following along. I don't know how Peter would cope with being this age. I don't think he ever thought of himself as actually being older, and he would have to confront that fact. He would be glad that out of his passing away came progress for other people in both healthcare and services, and hopefully ultimately in an end to HIV/AIDS. He would be very happy that Mount Sinai has kept its commitment to continue the clinic. I think that would be exceptionally important to my parents to know that even though they have moved on, I can't be watching over it, and my father can be pretty bossy, so I feel like he would come back and tell the hospital board, like, don't mess with it. You know, you think I'm gone, but I can come back and find you. But to know that the hospital really does seem to have a serious commitment to continuing the work that the clinic's doing.
I think the work is actually as vital and urgent today as it was, you know, even during the darkest time. And Peter Krueger Clinic continues to be at the forefront of that work. And so the mission remains just as vital as ever. And I think that will be the case for quite some time.
When I think about the Krueger Clinic, I see the little engine that could. You know, it's in its own little world, it's in its own little building, and it does its work in a nice, quiet way. But our programs are like, you know, Statue of Liberty. Give us your tired, your poor, your huddled masses. That's us. We want that population. And if other people say, I don't want them in my clinic, or it's too hard, or they need too many services, hey, our doors are open, send them on over. We'll figure out what to do with them.
It was such a struggle, you know, but now I'm good. I'm the grandmother and the mother to my children, who I love so very much. Today I'm happy, I'm content where I'm at with my life. I'm living life, I'm enjoying my life, and I'm gonna live it till it's golden, a day at a time. And I'll be 62 in December. And so many people knew my husband, they figured she has the virus, she's gonna die, but I beat the odds. I'm a survivor.
Life is a gift. And I was almost dead, and I bought into that, and I was in darkness for so many years that to be alive again. And I credit Peter Krueger Clinic for having a critical role in that, obviously. But my own personal journey to be alive again, it's almost like a rebirth. You know, like they say, the phoenix rises from the ashes. I feel like that, you know, like I've actually been in hell. I'm moving forward, I'm back to work. I even want to go back to school and get my degree. I mean, I'm 63 years old. I don't care. You know, I don't walk around with 63 years old in my head. I say I'm 63, you know. I'm as young as I feel, it's just a number. It mattered to them that I was suffering. It mattered to them that I was sick. It mattered to them that I was worth something.
Does the world know what could have been accomplished if these people were still here? What did we miss because they died so young? How would the world be different? And it would be. We lost a lot. We lost a lot of potential. Do we all go back and realize truly what the impact was? I think it's too much. It's too overwhelming. It's too painful. That if I really thought about it, I don't know what that would do to me. I think sooner or later in my life, I'm going to have to go back and just to accept it and embrace all the things that happened.
Peter is proud, I'm sure. I certainly can picture his face right now from the day I met him and from the day he died.
My journey is to just keep going, go for the stars, the highest peak to the mountains.
It's incredibly important to remember where you came from.